Well, welcome back to Your Optimum Health with Dr.
Edmund Chein.
And I'm Jeff Harrison, and we've been talking about your optimum brain health. And this is segment 3. If you haven't seen the first 2, you really should go back and see this because it's unbelievable about, hey, really what does our brain do? And then really the second part was all about testing. And we don't, Dr. Chein, I don't think for the most part that we think about, well, let's test our brain.
Yeah.
You know, we do the ABCs, we do some spelling, but there's some things we could do at any age to start checking our health. I mean, we go to the doctor and do a physical, but for our brain health, right?
Yes.
And you've given us some things. And before you leave, you want to stay at the end because Dr. Chen's going to show you how to, or tell you how to get a hold of these specific tests that you can start doing for you or even your loved one. Now, today we're gonna really get to the nitty gritty. Okay.
Yes.
Today we're going to talk about those 2 big, well-known issues, and that's Alzheimer
And dementia.
And dementia. In the last segment, you said, and this was disturbing. By 2050,
Yes.
if something's not done,
half
of the U.S. of
Over
65 and old will be dealing with this.
Yes.
I mean, that just blows me away.
Yes.
Talk to us about that, about Alzheimer and dementia, because you said in our first piece that these are all curable now.
Yes, it's curable. That's a shame. So basically, your job is to discover it. If you don't discover it, nobody can cure you. So you have to discover it. And discovering it meaning you have to watch out for signs and symptoms. You have to do the annual test that we talked about, the 1-leg stand, reversing the numbers, the 5 words and 5-minute test yourself every year. And it's until your doctor does it, you do it yourself. And once you find that you fail, then you want to go into causes. You go to a doctor that care about your causes. Now, that's the difference between Alzheimer's and dementia. Actually, they are intertwined. And Alzheimer specifically apply to people who have, for example, the ApoE4 gene, okay? If they have tested positive, okay, that's genetically prone to have Alzheimer's. Okay, so if they have dementia and have ApoE4 gene, then the doctor says, okay, you have Alzheimer's. Whereas if you don't have the plaques, the tau protein, the amyloids in your brain on your MRI, then they say, okay, you have dementia. But actually, it's just a matter of degree. When you get bad enough, trust me, your dementia will turn into Alzheimer's, even though you have no ApoE gene. We will call you Alzheimer's when you are that severe, have plaques and amyloids and tau proteins in your brain on MRI or PET scan. So basically, it's a matter of degree. So that's why I linked it together. Okay, and it's very important for you to think about yourself. Well, am I a high risk person? Well, let's ask your history. For example, did you have meningitis? Did you have brain trauma? Did you have herpes simplex infection? In fact, that was a surprise for me to find out from the conference that herpes from Dr. Bresson, that they've isolated herpes simplex virus from the Alzheimer brains. Interesting. Hey, a little skin herpes simplex that I will put a little zap on it and it goes away by itself usually, okay, I got shingles, okay, no big deal. What's the big deal? Hey, if you had shingles, 10 years later, 20 years later, it may have gone to the brain and you may have Alzheimer's. Look at your history. Go to a doctor who helps you look at the history. And also, look, are you having problem finding words? Are you having problem calculations? Were you a math genius in high school and now you can't add 2 by 2? Is that happening to you? And are you losing directions? Without the GPS, Google Maps, you can't go anywhere.
Wait a minute, I call that my never lost.
Yeah. So is that happening to you? And it didn't happen before, and it's new. Whoa, that's a sign. Okay. The next is anosmia. We call it the peanut butter smell test. You take a cup of peanut butter or a can of peanut butter, take it about 6 inches away from your nose, and you smell. You smell it one nostril, and you smell the other nostril, and if they're different, it's called you may have Alzheimer's, dementia, not Alzheimer, dementia, but it picks up very early. This happens very early.
Wow.
And then aphasia, meaning that I can't think of that word or that name. Hi, hi, nice meeting you. I met you 20 years ago, and I can't remember your name.
Gotcha. We take that so for granted. Like
So
they were just.
no, it's not. Yes, you can take it for granted if you go into the test and you pass. That's my point.
Okay.
Go home immediately. You forgot somebody's name in high school reunion. Go back home and do those 3 tests. You pass, okay, then you're all right. But if you fail, do that. That's pretty easy to do that 5-second count of 5 one extent test.
Yeah.
You fail, if you don't fail, it's okay. Fail, not okay. So you basically let things alert yourself, and then causes. We need to go into causes of Alzheimer's. There are multiple causes. Was just mind-boggling what can cause, and it's combination. It's not one factor. That's why Dr. Bresson says it will never, the human nature, human species will never find one drug to cure the Alzheimer's.
Okay.
It will never happen because it's not a one-cause disease. It's never, Alzheimer's and dementia is not caused by one thing.
Wow.
So there will be, if it's not caused by one thing, it's not going to be one drug that cures it all. So forget it, drug industry. I'm saying bye-bye. If I own a pharmaceutical company, I'll change my research. Get into another field. You won't succeed there. Wow. You will not have a drug. So basically, what are some of the common causes? We talk about ApoE4 gene. Genetically, you're predisposed, so you can do 23andMe genetic test. Okay, and so I got that. I'm likely to get that. Okay, or next thing is inflammation, infection. Okay, of the gut. The most common inflammation that people don't complain about is in the gut. And so you have to go to see a doctor here, and you go to and doctor usually have a list of symptoms and signs, ask you questions on your gut, and then from the symptoms and signs you say, oh yeah, you probably have a gut problem, and then that's when you have to check your gut. And if you have inflammation or infection of the gut, parasites, SIBO, small intestinal bacterial overgrowth, or intestinal dysbiosis, or parasites, or negative bacteria too much in your colon, or you have constipation, you only move bowels once a week, you have toxic colon, period. Those are toxins go to where? Brain. Okay, so you may not be having dementia if you had normal bowel movement. If you didn't have normal bowel movement for the last 20 years, you're going to end up having dementia. Those things are important. And then also another important thing that they talked about is environmental poisons. That is another big problem.
So if I live near a toxic dump, or if I live...
Oh, yes. And you don't even have to live in a toxic dump. That's the sad thing. Glyphosate, which is it's an herbicide that put out by Monsanto, is on every fruit, every vegetable, because it's sprayed by the farmer.
We think is the stuff we think is good for us. The apples, the oranges, the fruits.
Exactly. The more veggies you eat, if you didn't wash well, the more you're likely to get poisoned by pesticides and herbicides. And check it. The urine test. So basically, and on top of plastics, by the way, and certainly chemicals, petroleum chemicals, and certainly paraben from the dermatologicals that we use. All of these can contribute to cause dementia. And then certainly do not want to miss out the heavy metals. Okay, we get heavy metals, mercury, lead, cadmium, tin, mercury in the amalgam, in the mouth.
Right.
Go to a dentist, holistic dentist, and remove that. If it's not going to cause senile dementia, it's going to cause other problems. So check heavy metals, get rid of heavy metals, and you can get rid of heavy metals once you have them, either with the nutrition or with chelating agents like EDTA or DMSA. And you can find a doctor and chelate them, and then know that, I'm exposed to it, so I stay away from it. For example, I love to eat fish, but when I go to China now, I don't.
Oh. Because
the fish there are farmed, raised, and the water's been there for couple hundred years, and the mercury content gets higher and higher and higher and higher. So the beautifully bred fish that they have now, that's on the market, tastes beautiful, tastes great, they serve you, but the mercury content is very high, and I've been poisoned 3 times already.
Wow.
Yeah, coming back and be poisoned with mercury. And how did I find out? I lost my hair. I mean, and my hair just came out, in shower, and just boom. I said, what's going on with me? What's going on with me? Why do I had chemo? Yes, Dr. Chein, you had chemo. What kind of chemo? Mercury chemo. You just had a mercury chemo 4 weeks ago. So I had to chelate. That's how I found out. I checked my hair, and I found out.
From the fish.
From the fish, yes. So all of these, and the nutritional deficiencies, that I don't want to miss that. I mean, people just don't know. They don't know that. I have to have nutritional check. Everybody should have a nutritional check. Let's say every 5 years or so, to see their diet, the weight of their diet. Is there anything missing? And people miss nutrition because they cook their stuff. We cook it. We cook everything. We microwave everything, and so the nutrients are killed, dead. You can have CoQ10, for example, in your whatever food, veggie it is, but once you microwave it, that CoQ10 is dead, gone, denatured. So you can be CoQ10 deficient, vitamin D deficient, magnesium deficient, and glutathione deficient, and all of these nutritional deficiencies cause dementia. Wow! All you need is a little intestinal inflammation coming in, boom, the explosion happens. So basically, finding out the causes is very important, and then once you find out the cause and you have the symptom, you have the sign, then you have to see the doctor is good with knowledgeable about Alzheimer's or dementia, and they do tests, imaging to prove it, okay? Because it's an investment to go through the treatment program if you don't have the diagnosis. So the imaging tests are the standard golden standards, and it's MRI. Okay, it's called volumetric MRI. Your brain shrinks, and the MRI can show that it shrunk, or that 3 years ago it's this much, and now you lost more.
Oh, okay.
Your brain actually is shrinking, and the size of it is seen on the MRI. So MRI shows the volumetric change, and then there's the SPECT scans. So that's another test, brain test. Why do I need to do SPECT? I mean, I got MRI. No, because you want to see, are you having a perfusion problem that's making it shrink?
Okay. So when you say perfusion problems, what do you mean?
Blood vessel.
Okay. All right.
So are you having an arteriosclerosis, thickening an artery, or plaques all over your brain, in addition to you have an Alzheimer problem?
Okay.
So you can treat that shrink Alzheimer. If you don't shrink the arteriosclerosis, you're not getting successful because you have no blood supply going there. You are about to have a stroke, sir, or ma'am, because PET scan tells you the perfusion is coming down, meaning oxygen, it's not getting enough oxygen. Well, that means you are getting a stroke pretty soon.
Gotcha.
So people say, well, can I just do one test? It's too much money. I don't want to do 2 tests. No. If you want to do, try to. I just want you to know, if you don't do it, you are giving up what? What are you giving up? You're giving up another cause. They may be missed.
Because you said right away, it's like, Dr. Bretson in his study said there is no one cause. So there's no one drug that you can be taken. Exactly. So that's why you're suggesting the multiple images.
Yes.
The testing. Okay.
Because it checks different things. Checks volume shrinking, checks perfusion, and there's a PET scan that shows the temporal lobe or amygdala part of the brain. That if the PET scan is positive there, PET scans are radioactive. Call it radioactive, but it's actually very mild radioactive test. And if it's positive, it's diagnostic of Alzheimer's. So the doctor will say, oh, you have Alzheimer's. No, doc, I have dementia. No, you don't have dementia. You have Alzheimer's. Why? Because your amygdala shrunk, or positive PET scan on the amygdala. So those are what distinguish you from the dementia group. Okay, now you got a diagnosis, you got a crown that says I have Alzheimer now. Okay, on top. Okay, so it's important to have these tests, and so that you can invest your time, money to reverse that, efforts to reverse that.
So you want to make sure that, hey, this test is almost like saying, hey, just because I have a map and I want to go to Phoenix, if I take the wrong freeway,
Yeah.
I'm not going to get there. So these define, hey, where do you want to put your effort and your time and your money to reverse or eliminate these signs of Alzheimer or dementia, right?
Exactly,
Yeah,
exactly.
makes total sense.
Yeah, so basically, and on top of it, the picture gets more complicated if you have leaky gut. The leaky gut causes the toxins or the food, the beautiful food that you eat, the nice apple you eat, goes into the blood, and the blood becomes, the bodies perceive these apple and these foods as enemies, antigens, and form antibodies against them, and then boom, it goes to the brain. It can attack the brain, and contributing to that. So now you need to do the food sensitivity test. Now you got to do the leaky gut, which we talked about. Check the video on was a very well done video on leaky gut. Go through the leaky gut. Do I have leaky gut? If I have leaky gut, it can cause dementia, Alzheimer's. Treat that. You got to treat it. And heavy metals. Check heavy metals. Check urine. We talk about that. Only when you've done all of that, now we can come to treatment. And treatment is very simple. It's just check your hormones, make sure you have hormones are optimum, if not replace them, and all the nutrients that are missing from your nutritional eval, and exercise, not the regular exercise that we mean by exercise. Okay, run around jog for 10 miles. No. Brain exercises. There are 3 brain exercises that are free, by the way. I want to share with the audience. I think one's called Brain Elevate. It's on iPhone. It's free. Brain HQ, like IQ. Brain HQ, Luminosity. These 3 are free on the iPhone. So when you have time, you can actually start training your brain. And the reason, the more you play these exercises, the more connections are being made, restored.
Okay.
Cells are being born, new daughter cells are being born in your brain. That atrophy can be reversed.
Okay.
New brain cells, of course, growth hormone. We talk growth hormone will make the brain cells grow back. So all of these are part of things that you have to do as part of the treatment.
Are these items like, okay, I mean, we've all probably heard of luminosity, where it's like, okay, yeah, train your brain. But you say this is after we've determined what's going on.
Yes.
So if I let's say, for instance, my wife comes and says, "Hey Jeff, I want you to start doing luminosity because you forgot my birthday again," or whatever. And if we don't treat the symptoms, it's that same thing. Is we're just masking it, aren't we?
Not even masking it.
Now we get
you
back
probably have no result. You will probably want to sue Luminosity to say, "Hey, your game is a fraud."
Failed.
No, the game is not a fraud. You have problems getting results from the test, and then of course the nutrients, very important. Getting rid of inflammation, and getting all the nutrients that are necessary.
Excellent.
Very long list.
Yeah. Well, now, Dr. Chein, we said at the very beginning, there are some tests that can be taken right at the very beginning. So if you haven't seen those yet, call Jordan now. She's in the office. Call her now. She's on the phone, and she'll send you. There are several tests. Tell us what those tests are.
The ones will help you are the 2. One is the 5 words, 5 minutes test.
Right.
Which is MOCA. We'll send you the whole MOCA. MOCA is more. It consists of more tests than just 5 words in 5 minutes.
Okay.
And then the other one is the reversing numbers. The reverse numbers, and basically, Jordan will teach you how to have your friend or relative test you.
You mentioned that could contribute to that were amazing. If you forget that, go back. Well, you shouldn't forget it, but go back and watch this video. And now we're going to talk about something that I think we've forgotten. As a kid, we all did this growing up. We're Pee Wee football, and Pop Warner this, and a lot of stuff. I mean, I can't tell how many times I crashed on my bike. When you were talking about this earlier, I'm thinking, geez, I can't remember how many times I fell on my head on my bike. And I was in a bicycle accident when I was 13 and went through a car windshield. And so I think, geez, I can't wait to take this home and do this test and find out what's going on. I passed the 5-second balance test, by the way. But in this next one, we're going to talk about what?
Well, we're going to talk about a couple of trauma to the brain, brain injury, because that's the next high number. Traumatic brain injury, which includes CTE, which is limited to football only. Okay. That term, unfortunately, should not be. We should put all the football under traumatic brain injury. But the CTE was discovered by the doctor who studied the NFL footballs, the retired ones, and found out that they have CTE, chronic traumatic encephalopathy. We're going to talk about that. We're going to lump them together, and lump them as a traumatic brain injury, including the soldiers that come back now from doing tours in Afghan or in Iraq. Just by simply being there, seeing the explosion going off, just seeing it, survive it, seeing it, be around it, sufficient to cause traumatic brain injury.
Wow.
Yeah, and have personality changes and everything. I said earlier I said that the treatment is never a drug. Okay, never. It will never be a drug. But funny enough, marijuana is a treatment. Okay.
Thank goodness we live in California, folks. It's all legal.
Yeah, exactly. It is a treatment, and marijuana is a treatment and that's why a lot of these soldiers get on the marijuana, and before they get into trouble, and judges don't understand why they go on marijuana or why they go on alcohol and all of that, because these substance abuses have to do with preventing them from going into different mental states that
like
severe,
PTSD.
Yeah, very severe depression or suicidal. The marijuana can stop those thoughts, and the alcohol can, and the drugs can. So that's why they went into drug addiction. So we're going to talk about that next session.
Great. I look forward to that. Dr. Chein, thank you so much.
You're welcome.
And thanks for joining us on another session of Your Optimum Health with Dr. Edmund Chein. We'll see you next week.